The Minister of Health, Sibongile Simelane, has announced the new Medical and Dental Council of Swaziland, where she also announced the appointment of the registrar for the council, who will work on a full-time basis. Now, the chairperson of the council is Dr. Vusi Magagula. We have a report.
The Prime Minister's interministerial consultation meeting with medical practitioners in the country on Monday has already started bearing fruit. This follows the announcement of the new Medical and Dental Council of Swaziland by the Minister of Health, Sibongile Simelane, who also announced the appointment of a full-time registrar of the council.
We have got Dr. Vusi Magagula, who is our Director of Health Services and is the chair. And we've got also Dr. Shabang. And we've also have Dr. Lucky Matunjwa, Dr. Penwell Gina. We have got also from the AG's office, Lungile Magagula. And we've got also Dr. Tetelela Mteta. And for the first time in history, through the cabinet, we have been appointed Dr. Mahalian to be our registrar.
The chairman of the council, Dr. Vusi Magagula, said there are 5 main objectives of the council that include the registration and accreditation of medical professionals in the country.
Part of the registration involves validation of the certificates. It may involve making sure that the candidates have done some form of examination to show that they are qualified. The second function is it is involved in the training of the health professionals which is within the country. Those are the professionals who will then be registered or guided by the council. It should also even include licensing them as students, so that to make sure that they are followed up directly from first year to the time they graduate. The third function, which is also equally important, is to handle the patient complaints. So if a patient has a complaint with a practitioner anywhere, be it in government or be it in private practice, and then he brings it up, the Medical and Dental Council is supposed to handle that complaint, investigate that complaint.
Dr. Gina, who spoke on behalf of private practitioners, thanked His Majesty's government for supporting the council and in the amendment of the 1970 Act.
We now have a registrar who will be able to work full-time in the office. This will be tremendously helpful because all along we have had hard-working individuals who have been committed not only to the office but had extensive responsibilities within the Ministry of Health itself. And I think having somebody working there full-time will make a tremendous difference. And also, as already mentioned by the Director of Health Services, the review of the Swaziland Medical and Dental Council Act and amendment of certain sections will assist in ensuring that the Council carries out its obligations a lot more firmly than it has been able to do so far.
The council that was announced by the Minister for Health will be in office for 2 years as per the Act. Reporting for Swazi TV News, I'm Sibusiso Ngubane with LinkedIn Gule Mbabane.